Chapter 2, Recording 2. So we've been talking about kind of workplace wellness and how to keep yourself safe and healthy. Some issues that you may run into on the job. Cultural diversity is going to be a huge one. We take care of all sorts of people from all walks of life, and trying to treat them all respectfully can be difficult. Every individual is different, so we need to find a way that's going to be most respectful to the majority of people, and then learn from those that are not culturally the same as we are. You need to learn how to relate to people from different cultures. Sometimes it's as simple as asking them about their culture and trying to provide both mental, physical, and spiritual care for that patient. Learning a different language can definitely be helpful. Sign language can be helpful. Obviously, in this area, there's several different cultures, so trying to learn every single language might be difficult, but it could definitely give you a leg up on being able to take care of patients. Sexual harassment is something that is definitely not tolerated in the field. There's two different types. There's quid pro quo, or this for that. So trading sexual favors for promotion, that sort of thing, is what quid pro quo is. Or then hostile joke environments. And this is definitely the most common. So jokes, inappropriate touching, requesting dates, even just putting up like a funny meme can lead to a hostile work environment and can lead to a sexual harassment complaint. If you are experiencing any sort of sexual harassment or harassment in general, let somebody know and make sure that you document what's going on so that it can get resolved. There's no point in having work be somewhere that you can't enjoy being there because of something going on around you. Substance abuse, I talked about this a little bit earlier, but those that are in EMS are more prone to substance abuse because of the stress of the job. Definitely not a great thing to have. Definitely leads to poor decision making, can lead to improper or dangerous treatments for your patients. If you yourself are struggling, get help, period. Also in EMS, we definitely police each other and take care of each other. So if you notice a coworker or a friend struggling, find ways to get them help. A lot of employers do have employee assistance programs, EAPs, which provide counseling or can get you to some resources to get you help if need be. Emotional aspects of emergency care. You are going to be faced with difficult situations, and some are going to be difficult to move past. I think that if you talk to anybody that's been in EMS for a little while, there's at least one call that just kind of haunts them, something that they can remember more details about than any other call that they've been on. I know that I have two in particular that still to this day bug me, and I went on them over 10 years ago. It's normal to feel that way. When it starts obstructing your daily life, that's when you need to seek help. This is not something that goes away. It's not something that just gets better over time. Will you stop thinking about it as frequently? Yes, but at any moment, something can trigger those feelings again. And so learning how to adequately deal with them up front is much better than having them continue to haunt you year after year after year. Death and dying. as stated earlier, you are going to be faced with death and dying on this job. You may end up coming up on an accident where the person is already deceased and there's nothing that you can do for them. There may be times where you're called to a cardiac arrest, or a patient that you're transporting goes into cardiac arrest. You might have somebody that has a prolonged illness and their family members call when they're at end of life. It's just inevitable. Everybody that goes through grieving goes through the different 5 stages. They may go through them sequentially, they may jump back and forth, but what you'll end up having is denial, where they just don't fully want to grasp the situation, and so they'll say that it's not real, it didn't happen. Anger and hostility, they just get angry about the situation. There's a lot of why did this happen? Bargaining can be, well, if I do this, then I'll have longer to live. Or if I do this, I can have just one more day. It's generally bargaining with God, depending on what the patient's belief system is or their family member's belief system. Depression, just getting sad about the situation, and then acceptance. Not that they're less sad or that they feel less, but they just finally accept that the situation has occurred. What can we do to help patients, to help family members? The easiest is just ask them what you can do, how you can help. Try and be there for the patient and family. Are we necessarily going to be able to fix the situation? Not always. And that's the one thing that we always try to do as humans is, I want to say something to make it better. I want to do something to make it better. And sometimes there really is nothing you can do. So just being present in the moment, listening, may be all that's needed. Reinforcing reality, being honest. If somebody asks you a question about their prognosis, the am I gonna die? And you can't with 100% certainty say, no, you're not. Don't lie to a patient. Don't lie to a child. Don't lie to a family member. You can say things along the lines of, we'll do everything to make sure that doesn't happen. We are trying our best, but don't ever say, no, you're going to be fine, if that's not the correct answer for the situation. Definitely allow the patient and the family to grieve. Crying, contrary to popular belief, is okay. It's okay to be sad. It's okay to not understand a situation and to be upset about it. So allow them that time. Our response to grief. Some of the things that we feel inclined to say. I know how you feel. You have to keep going. That's not helpful at all. It sounds so trite, but I'm sorry for your loss. It's okay to be angry. That must be painful. That is more the appropriate way to go. It's hard to understand exactly how someone's feeling, and so trying to tell them that you do is probably going to make them more angry than anything. So there's a lot of better ways to talk to your patients. Dying, critically ill, injured patients all do have the same concerns overall. Anxiety is a big one. Pain, fear. Pain's often associated with an illness or trauma, and the fear typically relates to the potential of oncoming pain or future pain that they may experience because of the situation, or the overall outcome of what's going to happen to them at the end of this situation. It's okay to encourage them to express what they're feeling. Anger and hostility, your patient may lash out at you because you're perceived to be a quote unquote safe space, and they can't really control or lash out about the situation itself, but they can certainly express their anger and frustration at you. Make sure that you take care of yourself and that your personal safety is of your utmost concern. At the same time, though, be tolerant of what they're going through. Again, just because you don't see it as an emergency or something that's truly all that bad, this may be the worst thing that they've ever experienced. And the fact that they're in the middle of it and not thinking clearly could make it seem worse than what it truly is. So just give them a little bit of leeway and understanding. Depression, be compassionate, supportive, non-judgmental, irregardless of how you truly feel about the situation or the patient. It is your job to take care of them the best that you can, no matter what the situation is. Guilt can be very prominent, especially when a patient is dying. Their family members may feel quite a bit of guilt about not being able to do anything, feeling helpless in the situation. Dependency, patients definitely may become dependent on family members or on caregivers because of their helplessness, because of their situation. So if that person that they typically depend on is not there, they may kind of cling to you as a healthcare provider. Mental health problems, disorientation, confusion, delusions may develop in your patient once that brain is not getting adequate oxygen and the food that it needs in the form of glucose. Things start to not work properly. Common characteristics also include loss of contact with reality, distortion of perception, regression, diminished control of impulses and desires, and then abnormal mental content. So just random things coming up. They may receive unrelated bad news that may be unrelated to the situation that they're going through. This may cause the patient to kind of give up hope and not focus on taking care of themselves anymore because of whatever the situation is that they've been confronted with. Critically ill and injured patients, the patient needs to know who you are and what you're doing. Let them know that you're there to take care of them and their immediate needs. Avoid sad or grim comments. Try to be positive while still being honest with the patient. We're trying to reduce anxiety, but we still need to be honest at the same time. Orient the patient to the situation. Use brief statements. Don't go into a lot of detail. Make sure you orient them with their surroundings to keep them from being super confused, because that will add to anxiety. Make sure that you deal with the possible initial refusal of care. A lot of times, especially if more than one person is injured, they will say, no, don't help me, I'm fine, go help somebody else. They don't realize the extent of their injury. So make sure that you impress upon them the need for them to get care as well, or the fact that the other people are being cared for. Allow for hope, but don't give a false sense of hope. Let the patient know you're doing everything possible, even if there is truly nothing you can do to save their life. You can still be there, still be comforting, and not say, yep, no, there's nothing we can do, you're dead. Don't be like that. Give them some sort of hope that you're going to at least try. Locating family members, if they need somebody to be notified, make sure that you let them know that you will do that. This may just be a significant part of patient care, them knowing that you're going to contact somebody. Oftentimes people that know they're going to die will say, hey, tell this person this. And just you saying, yeah, I can do that, may be extremely calming and comforting to the patient. Injured and critically ill children. You still are going to care for a child like you would any sort of adult. They are not just small adults in the way that their body reacts. However, it's not super different. If you have to take in a child, oftentimes transporting their parent or caregiver with them will reduce anxiety. However, if the parent is unable to keep themselves under control or ends up obstructing care, it's just as easy to put them in the front seat of the ambulance rather than have them follow the ambulance. Oftentimes they end up putting themselves and you transporting their child in much more danger. Dealing with the death of a child, having a child die while you're caring for them or getting called to the death of a child, it isn't easy, period. It's often hard on us as well, even if we didn't know the child, even if we showed up to the situation, car accident, etc., and there was no treatment that we took part in, it's still extremely hard to be faced with the mortality of a child. Oftentimes you're going to need to help family and bystanders kind of deal with their initial reaction. You can provide information about follow-up counseling, support services, and then you'll end up needing to cope with your own grief as well. Trying to help the family out, maybe acknowledging death in a private place. Shock, denial, and disbelief are pretty common. If the circumstances allow the parents to hold the child. Don't keep them away if you don't absolutely need to. Sometimes actually seeing their child, holding their child is extremely comforting to them. And the same can be if you have a child or just family member and someone has died. You don't have to keep them away to shelter them, to protect them from that situation. If they want to see their family member, that is perfectly okay in most cases. Kind of let the family tell you what they think would be best in that situation. If there's something particularly gruesome or something that they won't expect, prepare them for that. Keep in mind that you may want to stay close because of what their reaction could potentially be. We will continue on in recording number 3.